Good afternoon, everyone, and welcome to Living Well with Dr. John, Adjustment Through the Lifespan. Today's topic is depression. Before we begin, I'm going to share two webinar disclaimers. The first is, this is for educational purposes only. For psychological services, please contact your state psychological association for referral. The second disclaimer is, the questions, comments, and opinions expressed during this webinar may not express the views and beliefs of the Christopher and Dana Reeve Foundation. Now for some background on Dr. John. Dr. John Chang is a clinical psychologist and is board certified in rehabilitation psychology. He is a professor of psychology at East Stroudsburg University, as well as a consulting psychologist. Dr. Chang also has a private practice through Doctors on Demand. Two quick notes before we start. Today's webinar is being recorded and will be available on the Reeve Foundation YouTube channel. Additionally, if you would like to ask Dr. John a question, please use the Q&A box located at the bottom of your screen. Now I'm going to turn it over to Dr. John. Hi, Dr. John.
Hey, Kaylee. Thank you for the intro. Thank you for helping me set this up. I've always want to start my podcast with thanking the people who are important in this process, the foundation, Christopher and Dana Reeve Foundation, for their support of this monthly talk. I want to thank Kaylee and Angela Kathleen, who part of the foundation, who has always supported in my process here. If I screw up on Angela's name, we're gonna have to blame Chris. He's the one that told me how to pronounce it today. So there you go. Thanks again, everyone, for coming. Good afternoon, good morning of those who are on the East Coast. Now, last month we talked an hour on anxiety, and I have to say, every time I try to prepare for these talks, you would think after 25 years of being a professor and speaking in a lot of engagement, I always get anxious about these things, and always an hour and a half before every one of my talks, especially for this one, I say to myself, why do I do this? And beat myself up and put myself in this position. But afterwards, I feel good, I hope. And I feel that I hope I feel as good as the last time and get people interested in some of the topics that we talk about today. So let's start with, our topic on today is depression. And there's a lot of different layers we're going to talk today, but I have to tell you, what makes spinal cord injury so difficult and what leads to many of us to depression is, well, like for example, this morning I was waiting to get ready to, I was eating breakfast, and then I noticed that my chair started to say, motor undetected, some error in my electric wheelchair. First thing I was just like, oh shit, there goes my legs. And I hate when my wheelchair goes down. And let me know if you guys ever had wheelchair electric and have this issue constantly. Now, I hate changing chairs. I have to admit, I'm in the process of getting another one. And I've had one in my living room for 9 months now, a brand new one that I can't get in. And my electric chair is 9 years old. That's probably fairly old compared to most people. I guess they turn around a little bit quicker than I do. It's because I don't like change, and I don't like something that's working. And when you change an electric chair, all of a sudden it changes everything from how you sit at your desk to how you drive your car, if you still drive. It just changes everything. And it was scary and frustrating this morning because I know what it could mean. If I can't get my electric chair going, it means getting back into another chair that I have as backup. I have backups to everything because I know how difficult it is to when something breaks down and you need it. And so, and next month when I bring my friend Dr. Alan McLeod on in our podcast next month, I remember just a conversation I had with him. And I said, "What are you doing?" He said, "Oh, I was just checking on my chair in my living room." I said, "Your chair?" He goes, "Yeah, I have another chair there where I plug and charge it every week where he has a backup." So, these things, when your legs can go out from underneath you, just there's anxiety. This is part of the process of struggling and being frustrated and having depressive episodes. So so here's my first question for you. Yes and no. Have you ever been in a sad mood for a while? Just feeling like you're down on the dumps. Okay, yes or no? Feel free to put in that chat there. Have you ever been sad for a while? Not just like sad for a few minutes or a few, it's like you've been in a funk for several weeks. So I'm curious of what my listeners are like today. So sadness is part of life, and most of us have experienced that level of I'm not comfortable what was going on in the real world. Early on in my disability, and the first few years, the biggest frustration I had. So let's see. Yeah, so that's good. Most people have had some level of depression for, no, let me take that back. Not depression, but sadness for a period of several weeks, which, in some ways that's normal. So sadness is not depression, and I'll clarify that a little bit. But early on in my injury, I've had fears and concerns about mostly just not being able to do the things around me, control my environment. If it's turning lights on to, now this is a while ago, but opening doors, going from place to place. In the beginning, I didn't drive. In the beginning, I was in a manual chair, so you can imagine me being in a manual chair. I barely could move. I hated rugs. Rugs were my enemy. All I wanted to do is go back to school. I knew that I had to go to school. I was stuck at home, and the reality of my life being paralyzed probably was one of the biggest fears and questions in my life at that time. Those first few years, I kept thinking, "Oh, I'm going to walk again. I'm going to walk again." If there's a God, trust me, I went to bed thinking I was going to just wake up next morning and wake up, and this dream would be over. This nightmare would be gone. And every time I woke up in the morning, the nightmare was still here and the dream was still going. And man, nothing changed other than I was in another day when. And that was frustrating. So my goal was, okay, what do I do with this life? What do I can't do most of what I used to do, which was athletic things. I lost most of my friends. By that time, the first year, and I apologize if I say some things that seems really hard, but that first year of injury, you're like a freak show. Everybody comes and visits. Everybody in the world that has to come and see you, which is good and it's bad. I guess good that people still wanted to see you and say their, I don't know, I guess their condolence in some ways. They just want to support you and say hi. But after that first year, anyone who's been disabled, who's gone through this, knows what happens after that. No one shows, very few people showed up after that. The freak show is over. And you're good. The people that truly cares about you are the ones that end up coming and visiting or staying, which for me would ended up to being about very few friends. I mean, you can count it in my hands, right? Five fingers there. That's about all it's left. Tell me if that happened to you. If when you became disabled, did this scenario happen to you? You first year, everybody visit, after that, it went away. So I am curious of that, if that happened to you as well. So I struggle with that. Did it lead me to depression? I don't think so. You know, about average percentage of depression in America is about 10%, 8 to 10%. Average depression for people with spinal cord injury is about almost 25 to 30%. So there's a significant jump, and it makes sense. Obviously, it's a huge change in our life, and I will talk more about that. You know, I've read several studies. I look at depression over time for people with spinal cord injury, and it's pretty consistent. You know, if you have it the first year, you're probably going to have it 5 years from there. People seem to carry on that level of depression, or at least the percentage of people that get depressed over time doesn't go up too much, doesn't go down. It's about the same average. And so different studies, some studies only had 10%, other studies had 40%. So it goes a lot of, it all depends on who's evaluating you and what kind of measures they're using. So coming back to our lives, yeah. So the very beginning of my disability, it was about trying to figure out how to live with a life with being disabled. You know, in the middle part of my life, as I was in school, going through my program, then I started to really think about, well, okay, I have possibly a career. I have possibly even relationships. Can I have a quote unquote normal life with house, cars, kids, wife, you know, those aspirations? And, you know, as I gotten older now into my latter, I would say in the third part of my life of growing older, some of those things worked out, and a lot of those things didn't work out. And I think that's just part of life. You know, you don't get everything you want, and you know, that includes not walking, and that includes and I'll be straight. I don't have children. I always wish I had kids. That didn't pan out for someone like me. Now, don't get me wrong. There's a lot of individuals with spinal cord injuries that have children. It's amazing that they can, both male and female. So that was just not part of my gift. So that is a sadness in my life. And so we, you know, have you ever been sad in your life? And most of us had. So here's my other second question to you. Have you ever been diagnosed with depression, which is a whole nother level of sadness? So have you ever been diagnosed with depression? Okay. So what are some things. What's the difference between sadness and depression? So I'm going to have Kaylee put up the criteria that what we use as psychologists to diagnose people with depression. Because so about 50-50 of people with depression and sad. So I don't want this talk to be completely sad because it's all about depression. So, but a lot of the things we're going to talk about is quite sad. So, but what are some of the criteria for depression? What do you think? Do you have to be sad to be depressed? Yes, you have. Sadness is part of depression. Is depression sadness? No, but if you're going to be diagnosed with depression by your doctor or your psychologist, yes, you have to be depressed, and you have to be not interested in most of things in life. Like you just don't want to do anything. Well, geez, people with spinal cord injury, most of us have already those too. And it must be at least for 2 weeks, right? It can't just be for a day. It can't be for 3 days. That's the last for 2 weeks. Now the criteria changes after that. You have to have 5 out of the following 8 symptoms here.
Here you go.
Oh, echo, stop. Everyone's listening. Sorry about that. So lack of interest, depression, fatigue. Are you tired? Now, here's the problem. This criteria, most of us with spinal cord injury who probably aren't depressed can be diagnosed with depression just because our spinal cord injury changes a lot of things about our body that doesn't come into play when looking at the diagnosis. Because if you think of it, are you tired? Do you feel worthlessness? I feel that every day. I wake up and I'm still feeling like I didn't sleep because my body is just in a lot of pain. My joints hurt all the time. Do I feel worthless at times? Absolutely, because I can't do most of the things around me. And can I not concentrate sometimes? Am I indecisive? Absolutely. Some of the medications I have to take just to manage my life makes it difficult to concentrate at times. So using this criteria really sometimes is difficult so you can't just base it on paper that, if you're a person with a spinal cord injury, are you depressed? If you don't have a spinal cord injury, these items, these criteria makes more sense. Okay. Now, if you go to one more slide, Kaylee, I want to quick show you something. So if I was looking at individual with spinal cord injury and trying to assess depression, these are the ones that I would probably go after a little bit more. How's your appetite? How's your sleep? Again, there's still a lot of reasons why people with spinal cord injury can't sleep well. If you have to be turned every 2 hours because so you don't have bed sores, well, that's going to interfere with your sleep. If you have bladder issues, that's going to interfere with your sleep. Guilt, energy, concentration, again, appetite, weight loss. Again, it's critical. It's really critical that we go through and make sure these items on this part are not because of your medical condition, and it is contributing from the psychological perspective. Suicidality. I talked about that in one of my podcasts last year. The rates of suicide is quite high for individuals with spinal cord injury, and the potential for abuse. Some of you who have caregivers like I do, you are at the whims of someone else who can potentially have a lot of power over you. So there are some abuse that can occur. So those are the questions that I would be thinking about. I would want to address during my clinical interview with someone. So what are some of the causes? What are some of the, so depression is what? It's the end product. Okay, it's what happens when things don't go right in the beginning, and thus you end up at the end with major depression disorder. Okay, the clients that I have, that I see, they truly are depressed. They don't want to get out. They don't want to leave the house. They don't want to get out of bed. And I'll address some of those questions that we have in my pre-registration questions that have talks about a few of those. So yeah, Kayla, you could take those symptoms off if you want to stop sharing. But so what are some of the causes? Well, what do you think? What is the hardest thing about your disability? Well, I'm gonna just put it out there. What is the biggest causes of depression? What do you think for you in general? If you never had depression, what would you think, based on your life, what would be the major issue in your life that would potentially lead you that way? So that's my first question. I have another question for you. Okay. And while you share with me in your chat about that, for me, what's the greatest cause of my life and frustration is barriers to my care. This caregiver issue is an everyday issue for someone like me, and for others, that is one of their issues as well. It's especially during this pandemic. That has been a huge stressor in my life, and I see people also wrote lack of accomplishments, limits for, and I'm going to talk about lack of accomplishment. That was a big part of my fear after my initial injury. Is like, what am I going to do with my life? How am I going to be productive in the world? And going back to school, having a career was a critical factor and has in my feeling some sense of self-worth. And someone has put that, the self-worth part. I needed to feel like I was actually a good person. And I hate to use that word good, but we tend to associate good with feeling like we're productive. If we're not productive in society, we're sort of bad. And although that's probably not the best label, but I didn't feel good about myself. I didn't feel like I could do anything. And when I was a student, I was like, okay, at least I'm moving in the right direction, and I have a goal in mind at the end to achieve. Excuse me. The paralysis. In the beginning, on the first few years, having to learn that this paralysis wasn't going away. So I had to find a way to stop thinking about how important it was for me to walk, how important it was for me to be able to do basic needs things, take care of myself, take a shower on my own, get out of bed on my own. Those things can't be important anymore. Now, that's a perspective from a quadriplegic. If you're a paraplegic and you are incomplete, those things are still reasonable to you. So for some of you, okay, but some part of even though you're a para or incomplete or a quad, you're going to have to face the fact that you will not walk like you used to or run like you used to. That's just part of your thoughts. And eventually, if you want to survive and do well in your head, that part of your life has to really slow down. That part of your life has to be devalued. When I say devalued, meaning it can't be as important as other things in your life. You have to decrease the value of being able-bodied and increase the value of being a person, with other things, other important values like hanging out with your family, being good to your spouse, having a career. You just have to. I saw one of the posts, someone said control, having more control in other areas in your life where you have more control, which can be like relationships. Okay. What other areas? I saw some lack of social support, being isolated. Absolutely. Many of us lost all those friends after that first year. So what do? How do you got to get out there. You have to be out there with people who are very different from you. I love going to, weekend festivals and getting out when we could, when the weather's nice, not when the weather's changing up here, which it's depressing. I hate to use that word today, but the winter, is coming. I hate the winter. I always want to be in the sunshine. Let me know if you hate the winter up here as well, in the chat, because the coldness is just bitter. I need to be in a warmer state. So those of you in California, Arizona, Texas, Florida, man, I wish I was down there now. But so lack of social support. So one of the best way to overcome this disability, avoid depression, is to be out there with other individuals with spinal cord injury. I'm telling you, that is one of the keys. I'm going to talk a little bit about that in our section with questions, because one of our viewers today asked about that and a little bit of that. I'm going to say to you, if you're a parent and you have a child with spinal cord injury, get this person out there involved with other people with spinal cord injury. I'm telling you, even in our Christopher and Dana Reeve Foundation, they have peer mentors. Get them involved with people that are similar to you, because there are so many individuals out there that are already succeeding in life way beyond me. And so next month, I'm going to bring one of those individuals to my podcast, Dr. McLeod, because you have to have one, socialization, but two, you have to have people who have overcome this before you have. And so that's really important. You socialize. One of the other areas that cause of depression that I struggle with at times, and I know many of you might have, is pain. We'll do a podcast on pain down the road here, but pain, it's one of the symptoms. Who out there right now has a lot of chronic pain like I do? That is one symptom that if you don't have that controlled, you don't have that somewhat minimized, man, it is so difficult to have a good quality of life. Pain is a pain in the ass. That's pretty much how I have to say it. So, and when I am in pain, all my energy, and those of you who have chronic pain, tell me if you go through this like I do. When you have chronic pain, you spend almost 100% of your time trying to find a way to decrease the pain. I'm going to say it again. When you have a lot of pain that's almost unbearable, you spend your entire energy trying to find a way to lessen the pain. And it's not about getting rid of it. We're not crazy enough to say, I'm going to just get rid of the pain completely. We're not that selfish. Trust me, people with pain, they just wanted to be reduced a little bit, enough to live life. And that is rough. And that's one area that when I see my clients with a lot of pain, that if we don't find a way to figure it out, it's almost impossible to do well with quality of life. Now, here's the good part. Here's the good part about pain, though, that people don't capitalize on. Everybody wants to find this little natural super pill that's going to just take a lot of the pain away, right? If it's, gabapentin, if it's Lyrica, if it's oxycodone, if it's some type of pump. And those are great. Don't get me wrong. Those are good when you're given a proper dosage and proper doctor monitoring you. But half of pain is also psychological. And you can attack some of that pain by managing some of your psychological well-being and lower your anxiety and find a way. So people don't capitalize on that. It's funny. One of the treatments we give for people with pain is anti-anxiety medicine. If we can reduce your anxiety, the pain seems to lessen. So think of that those of you who are spending a lot of time with pain, just make sure you also tackle the psychological part. All right. I wrote a chapter about pain management on once, and again, the part of psychology has a critical factor in making you feel a little better. Okay. What other causes of depression? Well, we say it's lack of social support, limited mobility, barriers to care, medication side effects. We're on so many different medications. It was funny. It's for many years, I rarely took any meds because I didn't need them. And I used to look at my patients who are 65 or older, they would have a handful of pills almost every few hours. And I'd be like, whoa, man, that's a lot of pills. It's almost enough you don't even need to eat breakfast because you have so many pills. And now I'm part of that group now. I start off my day with this huge handful of pills. And I end my day with a huge handful of pills. So if doctor gives you antidepressants for your treatment, it's good that they give it to you so it's only once a day or twice a day the most, because once you go up too many times a day, you're not going to take it. You're going to forget about it. So, and that's part of, being understanding of our lifestyle and what, a lot of the meds we're taking. So, so high anxiety, lack of control, overall sense of self-worth. Okay. Your thoughts of, that you're worthwhile in this world, and you are, but you have to find a way to make you feel like you are. You have to find a meaning, some form of meaning in your life. Some aspect of it that makes sense to you. For me, it was education. For you, I don't know. That is that one question that, as psychologists, as humanist psychologists, I would want to know what makes it meaningful for you to live. Now, it gets harder. I have a few patients that I see that are in nursing homes. And I have to admit, I've never had to live in a institution like that, and the restrictions that comes with that at times can be difficult. There's some pros. There's a lot of pros about it, but there's a lot of cons about that as well. The lack of freedom, and the feeling that their life is under someone else's control most of the time. For me, as a psychologist, I'm always trying to find a way to say, okay, what kind of meaning in life can I have with these individuals in an institution? Where can we give them the sense of pride or sense of dignity? So, so those are some of these causes. Now, I've also saw that sunshine plays a big role in my mood, and absolutely, I used to be a lizard, and I love sitting in the sun when I was younger. I try not to do that as much now with worrying about skin cancer and everything. But boy, in the early days of just sitting outside, although when I go to the beach now, I'm not a big fan of sitting on a beach and being roasted like a chestnut, on that beach. I don't know how people do it. They just sit there in that sun and let that sun bake you for a few hours. That's not, but I don't mind sitting for some reason, in the sun with my hat on the side maybe. And so let me know if you like to roast on the sun on the beach there, like some of my friends do. So treatments, where do we go with treatment? So you're depressed. They diagnose you with depression, and so the most common treatment, as all of you already know, is antidepressants. Now, before I even put that up, Kaylee put that antidepressant list up. I'm going to ask you, what is your best way of avoiding depression? Okay. If you have sadness in your life, or you feel like you're not motivated, what do you do? And put that on the chat there. Tell me, what do you do to avoid depression? So as a therapist, first thing we do is what we call cognitive behavioral therapy. What you think is what you do. So we got to change what you think, right? Cognitive behavioral therapy, right? Others, I saw exercise. That is huge for some mild depression. You can get away from mild depression by just exercising. But if you have really more moderate to severe depression, exercise won't completely take that away, but it does help. Exercise is probably the first thing I recommend. I have written in my notes, logotherapy, which is finding meaning in life. We have to be around, find meaning in life. Absolutely. You have to find a reason to exist. It's not because you can walk anymore, so you have to have another reason. And there's amazing people out there that can do a lot of different things. I see paraplegics who have a lot of function, man. They are, the grass is always greener on the other side. As a C5 quad, I always wish I was a C6. Well, in my dreams, I would be a para, because then I can bounce down steps and do those crazy things they do. But as a C5, C4 now, I'm more limited because of losing a lot of strength. So therapy, socialization, I saw distractions. Absolutely. You have to find what I love here's my problem. I love watching Netflix and when I get hooked on a series, oh my God, it's like, I don't want to stop till the series over. And so how many of you like to binge on a movie? You tell me yes, no, because I can't be the only one out there, man. But man, when I binge, it is like, I just can't stop. I'm obsessed and know the ending. And, and they know how to sort of capture you. The problem with the binge, just that type of distraction is that it overtakes you. You're like distracted for like 10 hours in one day watching, 10 episodes, and that's not good. That is not good for you. Trust me, that's not good for me. That's way too many hours in the front of the TV. That's way too many way too many potato chips because every time I have to watch a movie, I have to eat potato chips for some reason. And so it is not good. So distractions are good. A movie, exercise, how do others people, social, friends. Again, that goes back to that beginning. You have to have friends to get through your disability. You have to connect with friends. Now, to keep it out of your life, you have to keep seeing those friends. The problem is, do they want to see you? You might be a jerk, so maybe they don't want to see you. But if you're a nice person, they may want to see you more than once. If you're a bitter, angry person about your disability, no one wants to see you. No, it's hard for people who want to be around someone. It's a catch-22 for us with people with disabilities. We have a tougher life and we struggle. At times they catch us in those situations where we are not in the right mindset, and those friends will hang out with you for a while. Over time, sometime, eventually you're going to have to get your act together and feel better about life, because you want to be able to socialize with people, and you want to be able to attract people if you want to have a relationship, someone that's going to truly be into you for who you are. Let me just quickly put up, the traditional, this is what your primary care is going to give you. They're going to give you some SSRIs, and these are good. Why they're good, why they're so good? Because they don't have a lot of side effects. That's why what these men, it takes a lot of this to overdose. And that's why medical doctors can put this out like candy and see if it works. Okay. These are just lists of some of the common ones of Prozac and Celexa, Lexapro, with a lot of different side effects. So each one has their own unique things. Next. And then we have another set of SNRIs, which is serotonin and norepinephrine. So it's a combination of serotonin and norepinephrine. So the SNRIs. So it's same as the SSRIs, but just a little twist of norepinephrine. So we got like a common one be Effexor and Cymbalta. Those are two common ones that people have taken these before. Next, let's see what else can we do to avoid treatment. We have so medication, therapy. Obviously, go to therapy if you feel you're depressed. How do you know where you're sad versus depressed versus when should you go to therapy for either one of those? And here's my suggestion to you. You should go to them when your sadness or your depression interferes with too many parts of your life. If it's one thing once in a while, that's part of the diversity of life, the stressors of life. But if it's interfering with your emotional state, the way you think, your way you socialize, the way you feel about your body, you're in so much pain. Well, it's interfering with too many parts of your life. You should see someone for help. Okay, you should go. Who do you see? Well, I hope you see someone that actually understands about people with spinal cord injury, because those of you who have gone to medical doctors, you know that when they don't or do understand your life, because if they do, the treatment, the intervention is so much different than if the medical doctor does not have any history experience of working with people with spinal cord injury. So going to a physiatrist, rehab doctor is important. I think those are that's our primary care physician in some ways, even though technically they're a specialist. And as for psychology, go to a someone who has a board certification in rehab psychology. That's because that's what we were trained, and that's our interest. So, going to the board of professional psychologists and finding what state you're in and who's in that state who has a background in rehab psychology. So at this point in the talk, I am going to read a few of the pre-registration questions and see if I can answer some of these questions, okay? If you have a question, feel free to post it. I should have said that in the beginning. If you have a question that you want to answer, Kaylee will try to identify them and ask me in a few minutes. So if you have a question for me today, please feel free to post. So I have Julie out here, and she writes, any tips on how to better cope and deal with dysfunctional family? It's simply a matter of accepting what you can't change. She writes, SCI poses many changes. And Julie, thank you for posting this question. It's nice to have a little more information. She suffered her injury in 1995, and she's gone through the works, and she's pretty good in living with this. I think what is right says, she says, I feel sad about my family. Some of my closest relatives know my obstacles and behave with such ignorance. It is frustrating for her, and she does do her best to forgive them. I think many of us share her background and some of these experiences. She has a good partner, and her husband does give her some suggestions. He has a different perspective, and he seems like a very loving person. And she asked, when do you need to see a counselor? And I said, sort of my last answer, you need to go to a counselor when that anger and that frustration interferes with many parts of your life. And that, the worst scenario is you go to somebody and they said, no, there's nothing I can do for you, and you're pretty healthy. But it's better to get that checked than to see you struggle with that. How do you find a good doctor? Again, I would look at the American Board of Professional Psychology, look for the state that you're in, and see if there's any rehab psychologists. In the state of California, I'm going to say there probably is a bunch, how big that state is. So yeah, one of the things I'm going to also suggest is that if you have some close family members who don't truly understand your life and how things work, educate them. Really take there's been plenty of opportunity to have them or let them know sort of what you need for them to understand how your life works, and etc. I tell you, there's so many things out there that people just assume and they just don't think about. Many times people will schedule things, it's early in the morning. I cannot make anything that's early. There's a reason why our podcasts are 2 in the afternoon. But one of them is because my routine takes, 2-3 hours in the morning. So I'm not making an 8 o'clock meeting. Okay. And I have to educate my department sometimes, when they set certain meetings are really early. I'm like, if you want me there, can we do a little later? So let's see. Next question. Janelle writes, so again, better coping mechanisms to beat depression without having to rely on pills. Here's my takes on pills. I do believe that pills are good for you in one way or another, but if you want based on research, if you want more of an immediate reduction in symptoms, pills tend to work faster than therapy. But if you look at the long-term effects, the combination of pills and therapy is the best result. You get the biological system ramping up and then the psychological system carries it over for long term. Now, don't get me wrong. Again, having just to go to therapy is the best to resolve chronic depression. However, it will take a little longer to figure that out. Okay. Brittany says, how can we make our depression calm down when it feels like it's sneaking up on you? Many of you, those of you who are students of psychology now or in the profession as well, know that you can see the signs, you can see the symptoms. You know when you're starting to feel like you're not in the right place. And you feel like you're starting to go down that rabbit hole of, and first of all, I don't understand what's wrong with rabbit holes, but I mean, people go down rabbit holes, but I hear people say that, going down that rabbit hole. So I'm not exactly sure what that really means, but but if you're going down that rabbit hole, you have to have all those buffers, those lists of things that we talked about 15 minutes ago, and says, okay, I'm going to exercise, I'm going to see friends, I'm going to seek a counselor, I'm going to distract, I'm going to reduce my pain. You go down that whole list. One of my patients in the Missouri said, oh, it's like a menu. Yes, I said, exactly. It's a freaking menu. It's like going to one of those pancake houses and you open up, you got 38 pictures of pancakes. You know, you've gone to a place of good food when everything's in pictures. So you open it up, you got all these pictures. That's what I want. I want your menu of things to avoid depression. So let's see. Marcia in Virginia writes, I'm new to a partner to a man who suffered SCI 18 months ago. How can I best help him emotionally? Marcia, that's a great question. And that's first of all, the fact that you're even asking this question tells me that you're a great person, because you're interested in this person's psychological well-being. So you just got to allow him to do two things. One, allow him to vent when he needs to vent, because there's plenty of things he's going to wish he could do and he can't. And two, just accept him for what he is. He's going to vent, he's going to feel bad about, and he's going to be concerned about how you judge him, and you have, if you feel you can do this, not everyone can do it though. So, but if you feel you can do this, and accepting for who he is, that goes a long way. That goes a long way of feeling, and I'm guessing you're already doing that because you're with him. But he's only been injured 18 months, man. Wow. When I was injured that first few months, it was like giving birth. You know how babies get, labeled, oh, this baby 5 weeks, 10 weeks, 30 weeks, 3 months and 1 week. It's in some ways we're having our second birthday there. We're 1 week, 2 months post, 3 months post. So when I thought of someone that's 18 months post, I was like, oh my God, that's really long. But now, after 35 years post, I feel pretty old. So I hope I answered a little bit of your answer that question, Nicole. Kaylee, do we have any questions that popped up that you want me to address before I keep going?
Hi, Dr. John. We actually received a few about depression. The first question is, when do you know if you just have circumstantial depression?
When do you know if you have? So if it's just situational, I'm assuming that's what they're asking. Well, situational means an event has occurred and you're reacting to it, which means usually the reaction to that event is fairly close in time. You are upset about something that happened. It's an acute process, meaning the depression came on quickly. The change came quickly. Here's the difference. If you're still having that same issue 2 or 3 weeks later on, and I'm not talking about like a pain issue that's still there, but if you're having that issue, if you're still obsessing about something that happened 3 weeks from now because you had a flat tire or you had an argument with somebody and it's still in your mind, that's when it shifts over to becoming chronic, and it's not situational because you can't let it go. Okay. Situational means it's situational, means when a situation's over, you take a few days to figure it out and then you leave it go. You know, life has a lot of situations in our life, and most of us sort of let it go after a few days or a few weeks. But if you're living with it and you can't let it go, then it can be chronic and it can impact leading you down to depression. So, okay.
The next question is, can you have anxiety and depression at the same time?
Great question. Absolutely. Anxiety and depression goes hand in hand. So it's not uncommon to have anxiety and thus have depression, or have depression as anxiety. And that's why when you get treatments with medications, sometimes they treat one, sometimes they treat both. And you got to just figure out what's causing it. Is it the anxiety that's sort of leading the depression, or is it depression which ends up having anxiety? Absolutely. That's a great question. And thus we should treat both at the same time.
The next one is, what are some ways to naturally relieve minor depression?
Exercise, best way. If you go to the gym or do anything and get your heart rate about 80% max heart rate, meaning you're on a treadmill or something that go for a good jog, and you do that for a minimum of at least 20 minutes, 2 to 3 times a week, you're going to see yourself just behaviorally feeling better, because you're getting the body going. So mild depression, exercise, I don't think that's a good thing for medication at this point. So just exercise, distraction, just having someone to talk to, call a friend now and said, hey man, I just need to talk. Just catharsis a little bit. You should feel better after, very short time, because it's mild, it's not, and you're, doing things that keep your body and your mind distracted. Ultimately though, if you're having the same issue over time, eventually you need to find a skill to have not had that problem. Chronic problems will wear you out. Situational problems, no. So a good example is like having a leaky tire in your car. If you keep driving and have to keep worrying about your tire going flat, and when it gets flat, then you get in problems, and then you have to go pump up the tire every other day because that's going to cause you a lot of stress. Commuting long ways and a lot of traffic will cause you a lot of stress. But if you fix the tire, get a new tire, or you change your job so you don't have to commute so dang far, you're less likely to depress because the stressor is no longer there. Okay. Any other questions?
I think we have time for one more.
Okay.
When one is diagnosed with depression, how do you fully enjoy the period of time where depression is not mild?
Say that again.
When one is diagnosed with depression, how do you fully enjoy the period of time where depression is not mild?
How do you, I'm a little confused with that question. How do you enjoy the depression when it's not mild? I'm actually not understanding that question. I apologize. Can you read it one more time?
When one is diagnosed with depression, how do you fully enjoy the period of time where depression is not mild?
I don't know if you can, if I'm understanding the question correctly. If it's not mild, which means it's severe or moderate, if that's how I'm understanding this, how do you enjoy life when you're down in the dumps? It's sort of like a catch-22. You can't. That's the reason why you're depressed and you're in the moderate to severe stage. The goal is to find treatment to get you out of that stage. If you're really enjoying life, then you're probably not in a moderate or severe depression, and you're probably in the normal level or going into the mild level once in a while. But it's like, how do you be sedentary and be active at this? You can't. Behavioral theory says that when you're anxious, you can't be relaxed. So psychologists, we teach you how to relax, thus you can't be anxious. So to enjoy depression, it's almost like a opposite. You can't really enjoy depression. It's a problem that many of us suffer. And suffering is not good, although suffering is part of life. I do believe everyone suffers, and some of us are better at getting out of that suffering, and some of us aren't. Some of us have good friends that help us get out of that suffering, and some of us don't. So yeah, loneliness and isolation is not a good way to avoid depression. I have one question that I want to make sure I quick address before you guys go. Mary Ann in Ohio asked about her son. That happened 13 years ago. When he's 13, now he has no schedule, sleeps all day, he's up all night, lots of issues. Is this normal and for everyone? And I'm going to say, Marianne, the process of adjusting is normal, but how long he's been there is somewhat normal, but it's not a good place for them. It's not a good place for you, because I know you worry. You said it makes you sad. It must be horrible for you to watch your son struggle like this. Try to get other people with spinal cord injury involved in his life. That's the first thing I'm going to say. Get him socialized with other people with this. But the second is make an effort to get him to therapy, and so that he can help guide your son into a right direction, because he's definitely in a funk. The future of this type of living is not good. So we want to redirect that, put his energy in a better place. Right now, he probably just feels lost, and he feels like he has nowhere to go, and very few people to look up to. And he needs a bunch of people to look up to, like I have, and need a support and get out there. So I hope that answers your question, Marianne. In general, thank you for coming today. I have next month, I have my friend Dr. Alan McLeod coming on as part of my podcast. I hope you learned a little bit about depression and how to avoid it. Your time is important, so thank you for spending an hour with me, and I hope to see you next month. Have a good day.